it's Andrea again. I thought I would swap my outfit and join you again on the same day because if you're anything like me with your chronic illness, you do not get ready every day. It's a special event. Maybe you consider yourself a spoonie like I do, and you know you're in the right place if you know that you're a spoonie and you know what that means. Today I wanted to talk a little bit more about, I'm going to start with functional neurologic disorder, the condition that I would say gives me a considerable amount of trouble. Functional neurologic disorder is a condition that affects your brain, but not your structures of your brain, more so your the computer system, that the operating system of the day, Windows 95, if you will. So, you know, I don't think my brain is running on the newest MacBook software. Let's just put it that way. It's probably stuck back somewhere else. I had mentioned this in the previous video where I introduced myself, that it was the result of the condition that the world started to struggle with in 2020, that functional neurologic disorder became a large contributing factor in my life. However, I believe I was predisposed to have that particular bug attack me neurologically, as opposed to maybe somebody else who it would attack them in other areas of their body. There's so many of us, I'm forever hearing about through the grapevine, somebody who knows somebody, somebody who knows somebody who's now chronically ill. And I think we have a lot more chronically ill people in this world than we did prior to 2020. Now, I myself have been a chronic illness fighter as long as I can remember, really. I didn't have a good childhood. I've alluded to that in the previous video. And if you grow up in an environment that isn't conducive to maybe best case scenario for your adult life, you're usually at a higher risk of sustaining some kind of either autoimmune disorder later in life or other conditions. Think of it like if all your grandparents have diabetes and that's your bloodline, you probably are at a higher risk of getting type 2 diabetes, but it doesn't mean you're going to get it. There are active things that you can do to protect yourself. I don't know that being able to protect yourself so much in the neurological community plays as large of a role because, well, one, we don't really know too much about who is at risk. What is said at this point in time is that the people that are at risk to getting functional neurologic disorder are people who have some kind of mental health predisposition. And so somebody with PTSD, generalized anxiety disorder, let me think of something else, like bipolar disorder, anything where things inside of your brain aren't quite right, are at a higher chance, at least that's what they believe, of having a functional neurologic disorder. And functional neurologic disorder mimics a lot of other conditions. It mimics MS, and I would suggest that the average person who eventually does get diagnosed with functional neurologic disorder has ruled out MS. there are people over in the UK, physicians, who are studying functional neurologic disorder, like sort of as their main study topic. But the vast majority of physicians around the world are likely still stuck in pre-2015, when functional neurologic disorder was known as conversion disorder. It wasn't until 2015 that and correct me if I'm wrong on the year, but I believe it was 2015 when functional neurologic disorder was given its new name. Prior to that, it was conversion disorder. From the understanding that your brain is taking stimulus that's given to it and converting it into a subset of symptoms. And those symptoms can be as little as only symptoms that you yourself might be able to tell from living inside of your body, all the way to paralysis, blindness, deafness, like permanent paralysis, seizures. Non-epileptic seizures are the category that you would get unless you do as well have a seizure disorder. Funny enough, you can have multiple sclerosis and functional neurologic disorder at the same time, so that can be confusing. It's not a condition that I had said in my last video, it has a lot of stigma around it, and it really, really does. If you are in the position of being diagnosed with functional neurologic disorder, but your physician has also maybe dismissed or belittled your symptoms, or told you that it would just magically go away, give it time, forget about it, you just need to see a psychiatrist. The studies are starting to show now that you do not need to have PTSD or any other kind of mental health diagnosis comorbid with functional neurologic disorder to have it. You don't need to have a terrible childhood, although a lot of us do. As recently, I was looking up online, and it was around 80% is what they're guessing. So 20% don't have any history or predisposed condition that would make them at a higher risk of getting functional neurologic disorder. And so we don't really know what triggers it, but what at the base of it is happening is your body is constantly analyzing the stimulus around it. And normally it reacts as we would expect. And, we've come to expect over the years that the human system operates, when you tell it this, it operates, in a set direction. So functional neurologic disorder deviates from that. And it can have a lot of symptoms. For example, if you Google the symptoms just as a dump, you literally take one symptom and you just pop it in, maybe you have numbness and tingling sensation in your fingers. Maybe sometimes your vision gets a little bit blurry, but it doesn't go completely black. Sometimes it sounds like you're hearing your heartbeat inside of your head. You've maybe got a little tinnitus going on. That's the ringing in your ears. Maybe you're typing that in. Maybe you've had some shaking and you just couldn't understand why your hand started shaking or why your foot turned in a certain way. And you write all these symptoms down, and you're gonna get things popping back up at you like MS, Parkinson's. Depending on if you've got the cognitive component of it, maybe it's mimicking dementia, because there is I personally, my side that kind of follows the dementia side, and the little symptoms that dig over there in the dementia pool for cognitive functioning is word finding. That's been a significant problem for me my entire life. You'll often see me saying that thing, it's that thing, you put that stuff in it, and then you butter it, and then you eat it. The toaster. And so, they've actually said about dementia, just as an aside, the higher educated a person is for dementia, the longer they're able to hide it. So for somebody like me, I've mentioned in the previous video, I'm a registered nurse. And so big words are part of my life that I can't get away from them. I have to use medical terminology. I have to use all sorts of language that, you know, the average person just doesn't have to use. And so I've probably had functional neurologic disorder underlying for years, for one, to some degree. But it took, you know, the toilet paper situation. And I'm just gonna keep calling it the toilet paper situation, because apparently YouTube doesn't like it. The algorithm doesn't like it. I have a permanent toilet paper shortage from the condition that I got and that I still have from a year ago. So if I look back to prior to 1 year ago, word finding has always been difficult for me. And the different parts of your brain are responsible for different aspects of your understanding of life, how you move, how you remember, all of those sorts of things. And word finding was always difficult for me. So I align personally with word finding issues. It's not going to be hard to spot. Oftentimes I'm going to have to circle around. I might have to say something a different way. I don't know if I really want to edit the video, so you might just have to catch me staring off into space. Dissociation, that's another symptom. Or can be another symptom of functional neurologic disorder, where your brain just shuts off. Some of my favorite educators in the community of, I don't know, I suppose they're more on the side of like PTSD and that type of study is The Body Keeps the Score in the Healing of Trauma by Bessel van der Kolk. And he talks about dissociation in his book. And he takes a husband and a wife and he's able to compare them in a functional neurologic machine. So, functional MRI, which basically just means that they can see your brain being stimulated and lighting up in real time. And so dissociation is where a lot of your brain just basically kind of goes offline and you stare off into space. So I have a little bit of that as well. I unfortunately was lucky enough to receive paralysis as one of my symptoms. So the very first interaction that I ever had with a paralysis episode was on Mother's Day last year. So 2022, Mother's Day, whatever day that was in May. I started to feel just a weight about my body. My eyes got heavy, my face got heavy, my arms, my hands, my legs. I was laying on the bed. My husband was beside me and I said, like, something is wrong. And I was still able to speak, but it was almost slurred. Like I was having to work really hard to get the words out. And then I just couldn't. And he started talking to me. And at that point I was still, I think for part of it, I was able to talk. Slurred, but able to talk. But I lost the ability to use every one of my limbs. And I said to my husband, I can't move my arms or my legs. And so he said, well, perhaps you're having a panic attack. And I'm going, well, it doesn't feel like a panic attack, but I mean, I've had panic attacks sneak up on me just because I look wrong in the left direction. Like, really? Sure, it could be. So my husband said, well, why don't you take one of your PRN medications for panic attack? And I said, okay. And he came around to the other side of the bed and he grabbed me my PRN medication and he tried to sit me up and I couldn't sit up. So that's when I knew I lost all my abdominal muscles as well. And then he tried to we have a bed that goes up. We're like old people, you know, like we're fancy like that. And so we have a bed that will go up, and he raised the head of the bed so that it would support me. But when he tried to give me the pill, he put it in my mouth and then he tried to give me water. I couldn't swallow. Now, funny enough, swallowing has been difficult for me for many, many, many years. And I might go into a different video and I'll talk about coming in contact with toxic mold multiple years ago and having permanent neurological deficits from the incidents where I came in contact with toxic mold. And I had to have it remediated and tested, and it came back, yes, it was toxic mold, and that can do all sorts of funky things. And ever since then, I've had difficulty swallowing, but it's not normally where I cannot swallow. And this time, let's just call a spade a spade. I can be dressed up as pretty as I want, but at that point, I couldn't swallow. And so the water came and it just drooled down the front of me. And that's when my husband kind of started to get a little nervous. Now, one thing I don't think I've mentioned is my current husband is also a registered nurse and he has a different job now, but at the time he worked in the emergency room as a registered nurse, and he'd been there for multiple years. And so we are not the type to react suddenly to things unless it's alarming. At around this time, my 10-year-old walked into the room and she said, "Mommy, what's wrong?" And I was still able to talk, and I said, "I can't move my body." And then she looked at my limbs, and they were limbs of someone who was maybe no longer with us. As a registered nurse, again, I have the understanding of what it looks like when a limb no longer has any circulation to it. But all four of my extremities, my hands and my feet, they had no circulation anymore. They had no cap refill. They just there was no circulation. So whatever was happening to me, this paralysis episode, was taking away the circulation to my body. And so at that point, my husband wanted to get me to the emergency room, as I imagine most people in that instance would. However, I'm on the second floor, and so we call our friends over, and it does happen to be one of my good friends who walks in the door, and it's like, "Hey, how are ya?" "Well, I'm not doing so well. I can't move." So the first step is to see if they can get me into a seated chair that can take you down the stairs. But I have no stomach muscle, and they decide that that is way too high risk. And as they're trying to get like a line on me, because one of the first things that you do in a situation where you walk into a whole bunch of we don't know what the heck is going on is get access, because your veins can, deteriorate pretty quickly. So you want to get access really quickly. And around that time, my daughter, she kind of bounced in and out of the room, and my then 2-year-old was in the room as well. And we were trying not to panic because first of all, mentally, capacity-wise, I'm here still. Like, I haven't zoned out. Paralysis episodes can do that, though. You can be completely gone through them as well. But this one wasn't like that. So my daughter is coming in and out of the room, and she says, "Do you want to talk to my son?" And I said, "Well, no, honey, it's it's okay. I'll talk to him later when I kind of have a little bit more understanding of what's going on here. And so she just decided to phone him anyway. He was at his dad's house. She was here. Don't ask me why one was here where the other wasn't here. Like, two of them go back to their dad's house, and the littlest one is a product of this new marriage. So in any case, my son is on the phone. So they're trying to get the line in, and they've now called for backup because I cannot be safely removed from the house on the chair. And there's only two of them that came on the bus with EMS. So they called backup, which was 2 more fire trucks. And so in any case, they get me onto a blanket, and then they get me down and out of the house. And my ex-mother-in-law, she came over to watch the kids. And my daughter was essentially showing my son the whole thing. So all 3 of my children got to witness this, which is not anything that I would have chosen. I would have, like the littlest would have been at her grandma's house, and the 2 bigs, they would have been over at dad's house, and it would have just been me and my husband and my dog. And I would not choose to have my children see me incapacitated like that. In any case, I went to the hospital, and I've never presented to the hospital with anything that would... I'm so blessed, guys. I am so blessed. When I went to the hospital, what I'm trying to say is I was not told I was faking, okay? That wasn't it. Because when you test my limbs, if it was MS, they were testing in reverse. But then if you tested the, other part of me, I had, and I lost, I think, about 75% feeling in all my limbs. So I couldn't move them. At that point, I had been able to talk again, without slur, without anything. So I was basically just trying to answer questions as best as I could, but I was not immediately thrown into a CT, and I was not immediately thrown into an MRI. I don't want to go too medical into it because there's a whole backside as to the choices that we made to come to the conclusion as to what on earth was going on here. I don't even think in that moment I was all that panicked that it would be permanent, but there are people with functional neurologic disorder who have a paralysis episode that either only partly reverts or does not revert at all. Okay, I really want to say that I am blessed and lucky that my mobility came back. I've had more episodes since then of paralysis, but in 1 year, it's been 5 or 6 episodes, and I now have a system. So in any case, I'm in the hospital, and my right leg just starts seizing. And it's seizing like it's having a seizure all by itself. The rest of my body is not. And I'm screaming because it feels like there's Charlie horses happening in my right leg. I can't stop it. I can't go anywhere. The rest of my body is paralyzed. And my right leg is jumping around like a Mexican jumping bean. I have a video of it at some point down the road. Perhaps I'll put it in to show what it looks like, but it's really not that pleasant. So I was admitted to the hospital. They did every test under the sun. I might have been, sometimes I want to call a spade because the treatment that I received was absolutely wonderful and fantastic, but that is not always the case with functional neurologic disorder, okay? I went in And even if I didn't have the ability to voice my concerns, because there were moments where talking was either easier or it wasn't, or I was in so much pain from my leg seizing that I couldn't advocate for myself. But my husband, we basically went to his family, right? We went to his work, and he'd been working there years. And so I did not receive judgment, stigma, or any of that. I got wonderful treatment, and I do want to notice the people that don't, because there is a lot of room to grow with understanding and being morally right when we're dealing with people who have conditions we don't necessarily have answers to. Not having answers is different than faking something, okay? And there is a word in the medical world for faking. And so I think we can come and we can talk about those types of concerns as their own video. I want to talk more about like my own experience right now with functional neurologic disorder. So to move on, I was placed in the hospital in the cardiac ward. I believe my heart wasn't acting right, but I have POTS. However, that was not a diagnosis at the time, but I did have POTS, and so that's why my cardiac wasn't reading as nice as maybe they would have hoped that it would, right? So there was a lot of pieces of the puzzle here. One, we knew I had long toilet paper condition. That at that point it had made itself perfectly clear I was suffering a long time with limited toilet paper. We also had a history because I'm a chronic illness fighter. I have all sorts of different illnesses compiling into this. And so in any case, I was moved up to the cardiac ward, and over a number of hours, I gained some strength back. It was not bilaterally equal. My left side and my right side were not the same strength. The next day I went for an MRI, and I don't believe the neurologist came to see me that night. The next day they tried to get me up and walking, and they were so scared that I was going to fall over that the day after, when they came to try to help me ambulate, she came with backup just in case I were to fall backwards. She just wasn't in a safe enough situation. They have their own standards of care for that type of thing in the hospital anyway. So in any case, she came with a friend the next day, and I realized how scared she was from the first day. But then that next day, I was able to walk so much better that I was like, please let me out of here. I don't want to be here anymore. And they said, well, if you can walk up and down stairs, then you can go. And I wouldn't say that I walked up and down those stairs beautifully, but my husband said, well, you know, I'm going to be home with her. I can help her. And so ultimately we decided that I could go that day. Prior to leaving, I got to speak with the neurologist who told me I had functional neurologic disorder. Now, this neurologist knows how to positively assess functional neurologic disorder. And not everyone does, because a lot of people still follow the elimination. And while I think that eliminating things is important, because, like, for example, you can have MS and functional neurologic disorder together, so you should have an MRI to see if you have lesions on your brain, whatever it might be. But there are also positive signs. It's like the way that the muscles move, the way that they present, has a positive diagnosis now. Excuse me, where in the past it had to be done by elimination. And the problem with that is you put people through so many grueling tests, and then they have to be part of that medical community much longer. I have a family physician. A lot of people don't have a family physician. I do not have a neurologist. The place that I live, there's only, I think we're down to do, I think. So despite having a high level medicine physician, like highly respected in my community, referring me to a neurologist, I simply can't get in. And I think there's a lot of us that fall into that category too. So there is that. So I went home and large in part recovered on my own. In the last year, I have had like 5 or 6 more of those episodes, and I now have many tips and tricks for recognizing when they're going to happen and getting myself into a safe, comfortable position. Last summer, I decided to try an adaptive mountain bike, and I dislocated my right shoulder. And one of my paralysis episodes had me stuck on my right shoulder. And unfortunately, with that paralysis episode, my speech and facial movements, my eye movement, everything went right along with the rest of my body. So I couldn't tell my husband, I need you to roll me off this shoulder. I'm screaming inside because this is so incredibly painful. I just didn't have that ability. And so I think that one was 2 hours that I was stuck on that shoulder. And I also have degenerative disc disease in my spine, osteitis pubis. So like I'm a chronic pain sufferer. Like there's a lot that I can probably relate to the person on the other side of this video from. In any case, I have found ways to mitigate as best I can the situation of getting stuck. And like I said, I've been off work for the last year, so I've mostly been home. So the episodes have luckily happened here. If they didn't, how I would handle them would have to be large in part quite different. So I also have the seizures. My seizures come with warning. It took a little while to figure it out. All down my back gets this sensation of pressure. And I have the same medication that acts as a PRN for a panic attack. Also happens to work for me to reduce the chances that I will go on to have the seizure. But I only have 5 to 10 minutes to take that medication from that first feeling of pressure running all down my spine. And over the months, it's taken a lot to figure out what these seizures. Now, I want to specify that usually with FND, or at least to my understanding, always with FND, they are functional seizures in nature. They are not epileptic, okay? But that doesn't mean that they are fake. So then again, there's that difference. So you have to test that out with an EEG, and I haven't gotten around as of yet to having one of those. I believe that mine are functional in nature. My husband guesses that perhaps some of them are and some of them are not, but again, I haven't tested. But I do have a sensation that comes all through my spine when I'm about to have a seizure. And they walk and talk like a duck. I mean, the problem is that I'm usually mentally there still for the seizure, but my body is seizing just like you would notice for anyone else who has, say, even a grand mal seizure, right? Like, they're not pretty. They're very painful. If they happen quickly, I've had them happen on the stairs where I face planted on the stairs. I've had them happen in the garage on the stairs. If I'm about to have one of these functional seizures and somebody touches me physically, that is often enough to throw it over the edge and I'll have the seizure. But the difference is a lot of time, even if I'm only partly here, I'm still here enough to feel the pain of the seizure. I'm still here to know that, my shin is banging on the stair of my garage. I am still aware that my head is banging cement. I am aware of all of these things. So trying to do a pain stimulus on me to see if I'm faking or malingering with my seizure probably would elicit a pain response. I'm lucky no one's ever tried that on me. But if I had to write a little card that said, hey, I have FND, one of the things that I would put on there is do not elicit the pain response. I would really prefer if you did not try to do a sternal rub on me to elicit the fact that in their head, I am faking. Again, malingering. We can go on about this. It's not the same thing. And those who have FND are aware that you are not faking it. It is your body and your brain being unaware of what pathway to follow, how to have a normal neurotypical response to stimulus. And I have learned all sorts of fun stimulus that my body will revert into this seizure feeling. If my emotions get too high, if something catches me off guard and it is like severely emotional, oftentimes that's enough to throw it over. If my body gets overheated from the sun, you can see I have a sunburn right here right now. I took an intervention med while I was burning myself, and I was on my electric wheelchair, like way away from my house, and it was the first hot day, and I took my intervention med, and luckily it did not throw me into a seizure because I was by myself. I did not even have my dog with me, and we can get into my lovely golden retriever Gus at another point. This video is getting long, and there are so many things to talk about in relation to my experience with functional neurologic disorder, because there's so many little details of this condition that affect me, but I'm slowly learning how I can manage them. So I don't leave the house without analgesic intervention because I am a chronic pain sufferer. FND can give you chronic pain. I have chronic pain outside of the FND pain that can be triggered from FND. I'm not sure if, it's aggravated by having functional neurologic disorder, my already painful conditions, but I have degeneration in my T-spine and osteitis pubis I've mentioned before. And so like the amount of pain that my body was in prior to ever getting functional neurologic disorder, being diagnosed with it, was there. And so my analgesic pain medication manages the pain. We can talk about that because getting appropriate analgesic medication is very difficult in the climate that we live in for a lot of people. And even being on the top of that list to see somebody for a pain specialist, if your pain specialist leaves and they leave 900 patients stranded on whatever plan they're on, that's just what happens. And so, that's where I'm at with that. But I always now travel with analgesics and the intervention for panic attack. But honestly, my anxiety is well enough controlled that it is now my intervention for these seizures. And I'm just going to call them seizures. I'm not going to keep calling them functional seizures. Because at the end of the day, that's what they are. I just don't need to say it every single time, right? So I went out, and while I was baking myself, knowing that heat is a significant trigger of seizures and that I was alone, I did not have my dog with me. I took the intervention partway through, and that held me off the rest of the way, and I was able to be in the sun. Getting too cold, that's another thing that will throw seizures, and too much noise. I had a dog I actually very unfortunately had to rehome because his bark was so high-pitched and so frequent that he would throw me into seizures. And so he lives with my ex-husband now. which is really unfortunate, but he's very happy, and unfortunate for me, happy for them. So that's the two most major symptoms that I have a functional neurologic disorder. This video is getting very long, and I can talk for hours about functional neurologic disorder. I can talk about the little symptoms, the big symptoms, what I do to try to manage my life and try to make sure it's not interrupting things. And if I have to plan, you know, a date with friends, or I'm going to go out somewhere, I have all sorts of tips and tricks that I use to try to manage those events in my life. It is not a perfect system. There are lots of times I have to cancel on what I'm doing. There are lots of times where I have to leave the situation when I wouldn't want to. I would normally want to stay. Many things have changed, but those are the two largest, most debilitating of the symptoms. And outside of having an idea of what triggers them, I can't tell you when they're going to come. And living a life and having children, and I lost my driver's license because of it. As you can imagine, you know, like if, let's say I got this feeling through my spine while I was driving and my child kicked the seat behind me, right? And like I said, if I have that feeling and someone touches me, it often throws it over. So I would never want to be responsible for hurting somebody. So this has gone so far as to lose my driver's license. And I haven't been back to work in a year. And, you know, and we're basically at the 1-year mark of having that first paralysis episode. So I don't know what's to come in my life, but I know whatever it is, it's good. And I want to make this community, and I want it to be a platform where we can all kind of sit down and not feel judged and talk openly and honestly about the details, the nitty-gritty details of chronic anything. Chronic anything. We all, I mean, even the people who are not chronic are suffering in some way. I believe that the vast majority of people in this world are suffering in some capacity, whether it's mental health wise and it hasn't been diagnosed, or they're hiding it, or whatever it is. Whatever it is, we're all in need of moral, emotional, and spiritual help. So I don't know if the next video that I make is going to be a little bit more on functional neurologic disorder, or if I might bounce over to POTS for a little bit. I'm certainly done with filming today, and I'm going to upload this, and it's going to be really long. So if you've stuck through, maybe that really is only saying we have a lot of time on our hands and maybe we should be talking. Write a comment down below, subscribe, and, you know, let's walk this world of chronic illness together. Have a great day. Bye, guys.